Dr. David Staff. I've been in practice in gastroenterology for approximately a little over 15 years. I think gastroenterologists are probably like most subspecialists in medicine. We tend to like to have a hands-on approach, but we still like to have a patient interaction approach as well. And I found more and more over the years that the more interactions I had in active patient care, the happier I was personally and professionally. And the best thing about being a doctor is being able to have a positive change in someone's life. A lot of the patients we see come in with chronic medical illnesses, complaints that may have stemmed 20, 30, or even 40 years. It's a real great feeling to be able to see somebody turn around and walk out that door and know that they feel great about how they've just been helped. I had a professor who told me, if you tell me the right story, I'll give you the right diagnosis. And from that I gleaned a couple of things, but the most important is that 99% of diagnosing a patient's problems is listening to them tell you what the problem is. I encourage patients to sit and tell me what it is that's bothering them and how long it's been bothering them and all the different facets of their symptoms. Because largely my experience has been, by the time they're done telling me that story, I'm back to my professor's first statement, which is, if you told me your story, I'll give you the right diagnosis. And I think that's held true to this day, and that's how I try and approach every patient when I see them. Patients sense if they're being put into a cookie cutter scenario. We all hear about test after test after test, and indeed I'll hear that from patients that I saw a doctor and the first thing they did was order 6 tests. They may or may not have talked to me about the results of those tests, and then more tests came. And that's frustrating to patients, and they sense very quickly that they're not being heard. So I think if we make patients feel comfortable to start with, the rest of it follows, I think, quite naturally. I have a large family with kids ranging from 5 to 16, and a large amount of my personal time is spent chasing and or carting them around as much as possible. I try to take the time that I do have and make it as quality as possible. Hopefully I'm doing that, but I guess I'll find out in 20 years. I think the things that I always look back on the most are that patient you had that critical impact moment. To know that you made a difference and that they may or may not have been alive if you hadn't been able to do what you do. And I think there's no better feeling in the world.